Hey everyone, it's Haley and I'm back with another pregnancy update. Today I had my 38-week appointment and exciting things happened. I actually got to schedule my induction for 1 week from today. So when I'm at week 39, I am going in for an induction. And the reason behind this is because my doctors previously already told me that I would not be making it to 40 weeks because of my blood pressure prior to pregnancy. And recently, in the past couple weeks, my blood pressure has been a little rocky. It's been kind of going up, but that's to kind of be expected at the end of your pregnancy regardless. So my blood pressure hasn't been the greatest. However, I still feel great. And I've also been doing NSTs. So this morning when I had my NST, the nurse came in when I was all finished and she asked me if I had been experiencing contractions. And I told her, well, I don't think so. And her response was, well, look at the screen. And she showed me like these little, I wish I would have recorded them, but I had no idea what they were. I just thought it was movement of the baby. But she showed me on the screen, it was kind of going up and then it would go down and then it'd go level and then it would go up and it would go down and then it'd be level again. And that was Braxton Hicks contractions. I had absolutely no idea. I told her that I didn't feel anything. The only thing that I've experienced recently was I had back cramps yesterday, and I knew those were back cramps because I've had those previously prior to pregnancy during menstruation. So yeah, so I've been having Braxton Hicks contractions, had no idea. She asked me if I noticed that my belly would be contracting and kind of like harden up. And I told her, yes, I did experience that. And I have been noticing that, but I thought that was just the way the baby was positioned and moving. But come to find out, those are actually Braxton Hicks. So they've been nothing to where I can't handle it. Like I said, I had no idea I was even having them. And she told me that when it's a real deal contraction, that it will stop me dead in my tracks. I won't be able to talk, or if I can talk, I'm probably not gonna be a pleasant person. But she said you will definitely be able to tell the difference between actual contractions and Braxton Hicks. And like I said, I had no idea I was even having Braxton Hicks contractions until she showed me on the screen of whenever I would contract. So I thought that was pretty cool. Another thing is I was checked again today and I'm 50% effaced. So last week, my doctor told me I was 25% effaced, and I'm still not dilated, but I'm at the very beginning stages of that. So my doctor told me that she wanted to get the show on the road and she wanted to schedule my induction, and she scheduled that for directly at 39 weeks. The reason, like I said, is because I have had high blood pressure prior to pregnancy and my blood pressure started going up. It's not the best, it's not the worst. They're just worried about preeclampsia at this point, and they want to make sure that mom and baby are safe and have a safe delivery, which I'm completely okay with. I am super confident in my doctors, and I'm always want to go with what they are instructing. So I called my husband after my appointment because as of right now, spouses and children and your support person are not allowed at your appointments in the office. He will be able to be there for whenever I do have the baby, and when I do go for the induction, he will be there. But I called him and told him that he needed to get his affairs in order, that we were gonna be having a baby sometime next week. Induction is scheduled for Wednesday morning, but that doesn't always mean that you're gonna have a baby the same day that you have your induction. So I expect her to either be here next Wednesday or Thursday. It's kind of hard telling. I am a first-time mom, so things could progress really slow, or I could be a star and progress really fast. It kind of just all depends on what my body's doing and what baby's doing, and I just have to go with the flow. So I just wanted to make this video to update you all and So I can kind of remember this moment. Yeah, I'm gonna be a mom in like a week, so that's crazy. Yeah, so I will update you guys again if anything changes. Good morning, everybody. Today is August 12th, 2020, and we are on our way to the hospital to have a baby. So Matt, how do you feel about it?
Apparently I'm nervous.
Matt's nervous because he
couldn't finish my breakfast.
Couldn't finish his breakfast this morning and couldn't finish his dinner last night. So I don't know how much I will be videoing in this process because I don't know how it's gonna go, but today is baby day. So I've been here for a couple hours. They checked me and I was dilated to a 1 and still 50% effaced. So they administered Cytotec and I've got some blood drawn and we're just hanging out. How are you feeling, Matt? Are you calmed down now, less nervous?
Yeah.
Yeah, that we're all settled in?
Yeah.
Is baby coming today or is she gonna come tomorrow is the real question though.
Today.
Today? What time do you think she'll be here?
4:30.
4:30?
Yep.
Anything else to say?
No.
I also had to get tested for COVID, and that was probably one of the worst things I've ever had to experience in my entire life. They stuck the swab up my nose. She said I took it like a champ though, so there's that. I think that she'll be here at 6 o'clock tonight. So we'll have to see who's the winner and who's the loser. I hope I win. So, as you can tell, this update is coming from my house and not in the labor and delivery room. And here is why. Like you guys have noticed in my previous videos, I was well aware that labor and delivery, along with my whole pregnancy, was not in my control. And at the end of my pregnancy, obviously things were not in my control, and labor and delivery didn't end up in my control either. It was very different than I thought it was gonna be. So I'm just gonna give you an explanation, and I'm gonna give you a little bit of a rundown. And when I say a little bit, it's probably gonna be quite a bit of a rundown of what happened when we were in labor and delivery. So you guys saw the video of us on our way to the hospital. That was on August 12th. We left at a little before 6 a.m. and we got to the hospital around 6:50. We made a couple pit stops just because Matt wanted to get Dunkin' Donuts and I wanted to get a protein shake from the protein place. And so we showed up at the hospital around 6:50. With how everything is with the pandemic, we were required to go to the registration area, and we told them that I was there for an induction. And very quickly we were brought upstairs, and so we got to the hospital room like literally 10 minutes later, and I was dressed in my gown around 7:10 a.m. It was really quick shortly after. And we just kind of hung out in the room for a while. Then they administered Cytotec. You can do that, they can insert that vaginally or they can give it to you orally. They gave it to me vaginally, and what Cytotec is it's pretty much a medication that helps thin your cervix, and it just helps kind of progress labor and stuff. It's the first steps they normally take whenever you do an induction. Unless you're like already dilated, then you don't have to do Cytotec. However, I was only dilated to a 1, So they inserted the Cytotec vaginally since I was dilated to a 1 in hopes that they were going to help me progress and dilate me further. So again, I had that about 8 a.m. on the 12th. And then I had some blood work done. I mentioned that in one of the hospital videos. And I also had a COVID test, which I was not happy about. I did not want to do the COVID test because I didn't want to be tested for it. And for some reason, maybe the swab was already tainted with it, or maybe it would come up as a false positive. So I wasn't very happy that I had to do that, but I did it anyway. In the long run, it was probably best that I did that, and I will explain why in a few minutes. So when they did the COVID testing, I found it humorous because when they first came in to the room, they just wore their their masks, their regular uniforms, which are their scrubs, and they wore gloves. And when they came in, after they had asked me if I had my COVID screening, I had told them no. Why would I? Nobody told me I had to do a COVID screening. And they walked out and they came back in PPE. So I thought that was kind of funny that they were literally just in the room with me, just in a mask. And then they came back in fully in PPE. And I found that really funny. They would not come back into the room until my test results were back. And that was like an hour and a half. And of course they came back negative. So at my hospital, how it works out is that if I had refused to do the COVID testing, they would have treated me like I did have COVID, and they would have had me wheeled down into a different room, and I would have pretty much been by myself, and they would have had a nurse strictly that was just for me, and she wasn't gonna have any other patients, and it was just gonna be super kind of crazy. It was kind of like they were gonna quarantine me, so it was just easier that I did do the test. I mean, it did come back negative, so I didn't really have to worry about anything. But I just thought it was humorous that they came in regular gown, and then they came back to do my test in full PPE. I just thought it was really funny. So I had that done, had some blood work done just to make sure all my blood levels were good. They checked me around noon. So I had my first dose of Cytotec at 8 a.m. and then they came back 4 hours later, and they checked me, and I was only dilated to a 2. So I was happy with it because I was starting to dilate, though it did take a whole 4 hours for me to dilate to a 2 from a 1. So I was kind of frustrated, but at the same time I was really happy because I was progressing. I could just tell that it was gonna be a slow process from here. So then, since I was only a 2, they weren't gonna start me on the Pitocin yet. So they gave me another dose of Cytotec, and that was at like around noon or 12:30. And so in the meantime, I was starting to really cramp. It was like period cramps. It was nothing crazy, which I knew that's how contractions start, is by very light cramping. And so that was at noon. So they came back in around 4 and they checked me, and I was dilated to like a 3, and I was like, cool, this is literally gonna be the longest day of my life, the longest couple days of my life, because I was dilated to a 3 after another 4 hours. So I went from a 1 to a 3 in like 8 hours, and it was just a long time, especially when I was laying in bed, because after they give you Cytotec, you have to lay sort of in a flatter position for like a half hour. That way, like, nothing falls out. And I was having the worst back cramps ever. So uncomfortable. I was just not having it. I was ready to get out of bed, especially since I was dilating very slowly. I was kind of getting discouraged because I'm like, why am I not an 8? Why am I not a 9? Why is this taking forever? But again, I knew that labor goes its own way, your body does its own thing, and I have zero control over it. So Again, I was just going with the flow. Around 8 p.m. that night, they came back in to check me again. I was at like a 3.5 on the verge of a 4. And they were discussing with my doctor if they wanted to do another round of Cytotec or if they just wanted to go ahead and break my water and start Pitocin. And thankfully, my doctor came in and decided that she just wanted to get the show on the road. There's no, like, I'm at a 3.5, almost a 4, pretty much a 4, that why not just start with Pitocin, break my water, get things moving. And I was pretty happy with that. I'm like, yes, let's get this going. Like, I'm just ready to go. So my doctor came in and she took this huge crochet looking thing and broke my water. It was the weirdest feeling, very, very weird. And then they started me on Pitocin, and around, so in the meantime, while I was waiting for things to really get started, I was bouncing on the birthing ball. I was walking around whenever I wasn't hooked up to the monitors and the reason why I was hooked up on the monitors, for those of you who have never had a baby before, it's kind of like whenever I was getting my NSTs, they have those bands on you. It's just to see the heart rate of your baby, to make sure they're moving, to make sure the heart rate's okay, just to make sure that their heart tones are pretty much good. So when I wasn't hooked up to the monitors for that, I was walking around, I was using the bathroom on my own, just bouncing on the ball, just doing what I was doing, trying to progress further. That's my dog, sorry. So then my hard contractions, I would say, started around 9:30. And this is when I'm on the Pitocin, and my doula showed up around 10. And now my doula is actually my sister. She is actually a postpartum nurse, but she was able to be my doula, and she was my doula with me at the hospital. And I could not thank her enough for being there for me and Matt, because she is so knowledgeable with all baby stuff. She's really good at what she does, and she kind of helped me with my breathing. She said I kept breathing too fast whenever I was in a lot of pain, having my contractions, and she was kind of there comforting Matt, because Matt had no idea what was going on. This is new to both of us, but she is very knowledgeable and everything. So I was very, very grateful that she was able to be there for me and be my doula. So at the time that my doula showed up, I was having pretty hard contractions, and what was probably one of the harder things for me is that my contractions were one after the other. So once my contraction would be up and it would start to come down, it would go up again. And I literally had 0 breaks. And so I decided after a couple hours of that I wanted to try the IV pain meds, which is fentanyl. And I make that face because my body didn't like that. So I had to get up because I had to use the restroom, and my sister and Matt helped me to the bathroom, went to the bathroom, started walking back to the bed with their assistance because I was in a lot of pain because I was contracting the whole time. And I like stopped in my footsteps, and Matt looks at me and goes, "Are you okay?" And I immediately said no, and they hurried up and brought me back to the bathroom because I felt very nauseous, did not feel good at all. So I went back to the bathroom, and at this point, I was on my hands and knees over the toilet because I thought I was gonna throw up everywhere because the fentanyl and me did not get along. So I can't even tell you how long I was hunched over that toilet for. I felt god awful. Oh my goodness. The fentanyl, my sister had the IV pain meds, and my sister-in-law had IV pain meds, and they said they worked wonders. For me, didn't really work. I was still in a lot of pain. I don't even think the pain let up at all. And not only that, is that it made me extremely nauseous. So my sister got a hold of one of my nurses, and told her that I needed some Zofran stat, which if you don't know what Zofran is an anti-nausea medication, and they just gave that to me through my IV. And so I felt better after that. So this part's gonna be a little TMI, but so at this point, my stomach hurt, and I felt like I had to go to the bathroom, and they told me I was not allowed to go to the bathroom. And the reason why is because a lot of times if you feel like the pressure, they think it's the pressure of your baby. But mine, I just felt like it was just, I felt sick, like I had the flu. And that was definitely the pain meds that I had. I literally felt like I had the worst stomach flu of my entire life. I like couldn't see. I mean, I could see, but my vision was not the greatest. I felt super hot. I felt super nauseous. I felt like things might come out of both ends. And so I just felt so sick. And at that point, when I told them that I felt like I had to go to the bathroom, the nurse told me no, and that they would have to check me, and they asked me if I could make it back to the bed for them to check me, and I told them no. So my doula and Matt had to help hoist me up on the toilet so my nurse could check me on the toilet. So if you've never been there, I was in so much pain that I did not care at all. I was just on the toilet and my nurse checked me and I was still at a 4. And this was at like 10:30, 11 o'clock at night, and I was only at a 4. So I was in so much pain. My contractions were coming one after the other. And like I had mentioned previously, I had kind of zero intentions on getting an epidural, but I was kind of open to it as well. I was just going with the flow. If I needed it, I needed it. And at this point, I didn't know if I was so tense that that's the reason why I was not dilating. So I'm like, I'm all for it. Let's try the epidural. So when I was in the bathroom after they had checked me and I was only at a 4, I was in the bathroom by myself. And I had heard my doula talk to the nurse, say like, now I know she wasn't really keen on getting the epidural, but like, what do you think? She's only at a 4. Do you think it would help her relax her? And I could hear them. So I just yelled, I'm like, I want it. I want it. So, I was able to get back to the bed. And by the time I literally got back to the bed is whenever, they had the anesthesiologist there. And that woman, oh my goodness, she is my best friend. So I was honestly really nervous to get an epidural, but at this point I was in so much pain that I didn't care like how bad an epidural was gonna hurt. So they literally have you hunch over the bed and put your back out as far as you can. And they first give you medicine to help numb the area. And then they give you, they put in the catheter or whatever to where they can give you the medicine. And no joke, as soon as they administered the catheter and gave me the medicine, I instantly felt relief. It was literally instantaneous for me. It was wonderful. They had asked me if I could feel any of the contractions, and I felt absolutely nothing after that. And they were like, really? You don't even feel like your belly tightening? And I'm like, no, am I supposed to? Like if I put my hands on it, obviously I could feel my belly tightening up. But me by myself, I could not feel the contractions at all. So obviously, since I ended up getting an epidural, they require you to be bedbound. That's for obvious reasons. Obviously, I'm numb from pretty much the boobs down, and you can't really walk around. You can't get up to use the bathroom. You can't bounce on the ball. You just lay in bed, which is fine by me. It was super late at night and I was pretty tired from the contractions that I had been having. And so I was hoping to get a couple hours of sleep. At this point, they put in a catheter for my bladder and again, didn't feel a thing. After I got the epidural, I felt so wonderful. However, after a while, when I would have contractions, my baby's heart rate kept going down. And so the doctors would have me lay on my sides and her heart rate would be okay. But after I would contract, her heart rate kept going down. And we were trying to figure out what was going on. So I was on the Pitocin at this point and I can't remember what level I was at. And so they kept switching me from side to side to see if that helped with her heart rate. And they ended up giving me some oxygen, and I was taking oxygen. And then that would help a little bit. Her heart rate would go up, but then her heart rate started tanking. And at one point in the night, it was like 2:30 in the morning. I literally lost track of time when I was in labor. I felt like at one point it was 8 o'clock, and the next time it was like 6 a.m. It like, as much as the pain that I was going through and all the things that were happening, I felt like time was flying by. Like, it was not standing still at all. So at one point it was like 2 in the morning, and this is after I had gotten a little bit of rest. The nurses ran in because her heart rate had plummeted to like 50 beats per minute. And that was right after I had a contraction. And again, my contractions were one after the other. They were not stopping at all. So they hurried up, changed out some IV bags, and they flipped me over to my other side in hopes that her heart rate would go up. And they were able to maintain that. And at this point, my doctor had come in, and she just like was checking out, seeing what was going on, trying to decide what to do next. They were at that point discussing a C-section right away. And that's what my doula had told Matt. She's like, she's gonna have a C-section right now. And this again is at like 2:30 in the morning. It might've been a little earlier, might've been a little later. Again, I lost track of all sorts of time whenever I was in labor, because just everything that was going on. Like, it's one of those things that I feel like, I don't know, I just lost all sense of time. So my doula was telling Matt, she's like, no, that she's gonna go for a C-section right now. Like, her heart rate just tanked. There's no way they're gonna not cut her open right now to get that baby out. That baby's like needs to be safe, and this is not a safe heart rate for the baby. And so at that point, I like could see the terror in Matt's eyes, because I knew what was going on. I knew that if her heart rate kept tanking the way it was, that the C-section was the best option for us. And I looked at Matt, and again, since it's the pandemic and you have to be cautious, even though I was negative for COVID, we were all required to wear masks whenever personnel, like staff, came in. So we all had masks. So you could just see the terror in Matt's eyes. He was completely terrified about me having a C-section, even though we had discussed it. And we were both going to be ultimately okay with it, just as long as our baby was okay and that I was okay, but mostly the baby. So you could just see the terror in his eyes. And I looked at him and I'm like, it's okay. Like, it's okay. Like, we're just going with what the doctor says. Like, you don't have to look so scared. Like, they know what they're doing. It's okay. But obviously my reassurance to him, like, he doesn't know what to expect. A C-section is completely like a crazy major surgery. And I've never had a major surgery in my entire life. And he doesn't know if I'm going to be okay. He doesn't know if the baby's going to be okay. I mean, I didn't even know if we were going to be okay, because I didn't know why her heart rate was plummeting like it was. So ultimately, they decided to try to stop my contractions. And they gave me a shot in the back of the arm. And I can't remember exactly what the name of it was. Whenever I figured out, I'm going to put it right here. But the whole point of this medication that I just posted right here, it is to stop contractions, and they give that to you in the back of your arm, and it hurts really bad. Like, that hurt more than my epidural hurt. And they also stopped the Pitocin, and my contractions were not stopping. So they decided that they were going to give me a second shot, and they gave it to me in the other arm. And again, that hurt more than my epidural hurt. And again, my contractions weren't stopping. So for the next couple hours, they were just rotating me from side to side, monitoring the baby. And they also put internal fetal monitors on the baby. So how they do that is exactly how it sounds. It was internal. So I'm glad I had an epidural for them to put these monitors on my baby, because they put that while, I mean, I was numb, so I didn't feel a thing. But if I wasn't numb, I couldn't imagine how that would feel to have those monitors on my baby, or even have them put it in there while I wasn't numb. I couldn't imagine. So I'm very thankful I had the epidural when I did. And so they also did that just to make sure baby was good. And again, her heart rate kept dropping, but not crazy like it was before, but it still wasn't great. And I was still on oxygen at this point. And my doula had asked the doctors, like, so this medication that you gave her, like, how many doses do you give a patient? And they said we can give up to 4. Again, this medication, it kind of depends on the hospital that you go to, because I've heard of hospitals only doing 1 dose and hospitals doing 4, and anywhere in between. So my hospital just said that they would do a total of 4. And again, at other hospitals, they only do 1 and see where that takes you. But my contractions were not stopping, which to me is kind of cool to think about, because my body was finally doing something it was supposed to be doing, but the doctors were trying to stop that because of baby's heart rate kept plummeting, and we didn't know why. So 6 a.m. rolls around and baby heart rate keeps dropping, and my doctor comes in and she pretty much just looks at us, and I'm again still dilated to a 4. So I was dilated to a 4 for hours, and baby's heart rate kept dropping after I would contract. And doctor came in and said, you know, this is about the time that we really need to discuss a C-section. And I just looked at Matt, and I looked at my doula, and I looked at the doctor, and I told her I just want to do what will make the baby the safest, how she can come into this world the safest way possible. And I'm like, if a C-section is the route that we have to take, then a C-section is the route we have to take. I even told my mom a couple weeks prior to me having the baby that I was gonna have it in my head that I was gonna have a C-section, just because I didn't want to disappoint myself if I did have to have a C-section, which I don't know why I would be entirely disappointed, because a C-section is major surgery, and the recovery for a C-section is so much worse than a vaginal birth is. And I don't know why I felt so down on myself. Maybe it's because I was hoping that my body would do what it was supposed to, but it didn't. But I'll kind of explain further on that in a few moments. But so if you end up having to have a C-section, there's no shame in it. I don't know why I had it in my head that I was going to be disappointed if I ended up with a C-section, because again, my baby's here safely now, and there's no shame in having a C-section at all. Like my best friend, I literally followed in her footsteps. She would not progress from a 4, and she ended up having to have a C-section as well. And her daughter is here and perfectly healthy, and she is growing like a weed. So yeah, I don't know. Again, I don't know why I was just kind of disappointed and had my mind set up for that. I think it was just hopes that things were going to go smooth like my whole pregnancy had. But again, I found out at the end of pregnancy that I can't control anything, and this is how it ended up, and I'm completely okay with that, and I'm recovering okay. So again, at this point, I told my doctor that I was ready. Let's do this. Let's get the baby here. Let's get the baby out. Let's get the baby safe in a controlled area. And that's what we did. So that was like 6 o'clock in the morning, and by 6:25, I was being wheeled into the OR. That's how quick this happened. We were met in the hallway by the anesthesiologist, and since I already had an epidural, it went by super quick. She injected my epidural, like the catheter, with more numbing, and Matt waited in the hallway. He was gowned up, I was gowned up, and I was wheeled into the OR while Matt had to wait in the waiting room while they prepped me. So honestly, what was going through my head at this point? I was terrified. I have heard horror stories about having C-sections. My best friend, who I just said that I followed in her footsteps, she was in such a panic when she had her baby that she said she felt so much pressure on her chest that she couldn't breathe, and she was freaking out. And so I was like terrified that I wasn't going to be able to breathe. I was afraid that I was going to feel everything. I was afraid I was going to feel a little bit of a poke, and I was really scared because I didn't want to feel any pain, because they cut through a lot of tissue and nerves and skin, and muscle, and I was just very scared. I would be lying to you if I didn't say I wasn't crying, because I wasn't full out like sobbing crying, but I definitely had tears in my eyes as I was being wheeled to the OR because I was terrified. Like I said, in the hallway, as I was being wheeled there, they administered more of the epidural. And when we got in there, my doctor was like, all right, so this is a pressure and this is a poke. So I could feel it, like she did it on my arm. So I could feel the difference. And she's like, all right, tell me when you feel the poke. Poke, 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 poke. I couldn't feel the poke until it was up around my breast area. So she's like, all right, good. Sent my husband in. He came and sat next to me. And next thing I know, they said first incision. And that was the start of it. So at this point, it's probably 6:35-ish in the morning, super early, super tired. I was just ready to meet my baby. I was ready for this to be all over and for my baby to be here and safe. So once they started, I felt like it like just flew by. The most I felt was just pressure, and that was pressure of them pulling and moving stuff. And the weirdest thing to me was the amount of relief I felt in my abdomen whenever they pulled my baby out. And when they pulled her out, she cried here and there, but not like a normal baby cries. And I heard the doctor said, in her medical terms, one cord, like pretty much her cord was around her neck one time. So I knew that. And when they brought her out, they brought her over to like the little warming area, and the people that they had there were NICU, because they didn't know what was going on with the baby, why her heart rate kept plummeting. And so before they had pulled her out, the NICU guy had come over and talked to me and said that what was going on, what they were going to do, and yada yada yada. If she needed to go to the NICU, then daddy would go with baby, but if she didn't need to go to NICU, daddy and baby were staying with mom until we got back to the room. So when they pulled her out, Matt went over to her and they had to put like a little breathing treatment on her. And she finally started breathing and crying regularly after a couple minutes. And then they asked me if I wanted to do skin to skin. And of course I wanted to do skin to skin with my new baby. Like, I had all intentions of having a vaginal birth and doing skin to skin right after. And that didn't happen. So of course I wanted to do skin to skin with my baby. So they brought her over to me, and she looked identical to me whenever I was first born. So I'm like, wow, she's a spit image of me. And I was like this little dark colored baby with like black hair, and she like looked identical to me, which was pretty cool. And then I remember just like looking over at Matt, and Matt's like, sorry Matt if I'm embarrassing you, but Matt just like, not that he was like sobbing, but he was like, it was the most perfect moment. And I wish that it could have been different, but my baby's here safe now. And I remember when I was doing skin to skin, they ended up, when I was done doing that, they took baby back over to make sure she was still good with her like breathing and stuff. And my ears for some reason were super muffled whenever we were in the OR. I don't know why, but I remember Matt saying something, and then he like laughed, and then the doctor said something back to him. So once we got back to the room, Matt was like, did you hear what I said? And I'm like, no. And he's like, she kept stapling, and I asked her if she was done, if she was close to being done yet. And she said, yeah, she was almost done with her book. She was almost done stapling her book report. So I thought that I had all these staples in my belly, but it's actually, they were internal staples, and they actually like glued my incision area, and they held us together with tape. And then they put on this like silver, it had silver in it, like a swab, like I can't even think of what it's called right now, something they put over cuts. I'm drawing a major blank, but it had silver in it to help prevent infection. So like when I went back to my 1 week checkup, post-surgery type thing, she said it looked great and stuff. So it's healing really well. And yeah, so once we were back in the room, they took her measurements, and she was a perfect little baby. Had a little bit of a cone head, but that's to be expected whenever you're in a birth canal for a little while. That went away like really quick. I think that went away within like the first couple hours. And so we got a couple pictures, and we were able to bond with our little baby girl that finally made her appearance on August 13th at 6:43 in the morning. So after we had her, I was in the recovery room, which was my labor and delivery room, for a couple hours, and then they wheeled us to our postpartum room. And the room for postpartum is so much smaller. And since we were going through a pandemic and I had a C-section, so since I had a C-section, we had to stay an extra day, which totally bummed me out because I really wanted to go home. And since we were in a pandemic, we were not allowed to have visitors. So I had to stay an extra day, and we were so bored. And I felt like the days took forever. And I think it's because we weren't sleeping, because every couple hours nurses would come in and take my vitals and take baby's vitals and stuff like that, make sure that we're both good. And I think so roughly 21 hours, I got my catheter taken out. I was able to get up out of bed and walk to the bathroom. That was a little rough. It was very sore. I got my catheter taken out. They said one of the things that they really want you to do after you get your catheter taken out is to use the bathroom, and I was able to do that right away. And they were really, they couldn't believe it, honestly, like how well I was out of bed moving, and I'd already used the bathroom. And I think I was just motivated because I wanted to go home. And so far, recovery's been good. I'm almost 3 weeks postpartum now. I've dropped 35 pounds. Yeah, I've dropped 35 pounds. I'm 10 pounds away from my pre-pregnancy weight. I'm not swollen anymore. I don't know if you guys can tell my face. I'm not swollen anymore. My feet are nowhere near as swollen. I forgot how skinny my feet were. My legs are a lot skinnier. I'm a lot skinnier. So that's fun. But yeah, I am just happy to be home. I love being a mom. Our little girl is, knock on wood, an easygoing baby so far. She only cries when she's cold or hungry, or if she's gassy and she needs to be burped. But I couldn't ask for a better baby. And like I said, I love being a mom. So I just wanted to kind of give you a rundown of everything that happened. And again, like, I knew that labor and delivery and pregnancy, you have zero control over. And I'm glad that I had that in my mindset. And I'm glad I didn't have a birth plan, because nothing would have went to my birth plan at all. I also forgot to mention that my hospital is super pro VBAC. So literally right when I was in my recovery room holding my baby, the nurse was telling me that when I have my next one, if I was having a next one, that VBAC is an option for me. So a VBAC is a vaginal birth after cesarean, and I had a C-section. I had a cesarean section, and she told me that they're very pro VBAC. So I think next time I will definitely try to do a VBAC, but obviously I can't control any of this. I can't control like any pregnancy. I can't control like my birth and my delivery or anything like that. And I'll just have to go with the flow again. And like I said, I'm glad that I had that in my mindset, because nothing went as planned. Nothing went like I thought it was going to. And again, that's okay, because that's just how life is. You can't really plan for things. Things just happen. And yeah, so I hope you guys enjoyed this. Next video will be a lot quicker than this one. It's just been a crazy couple of weeks, let me tell you. But next video, I will let you guys meet her and I'll share her name. All right, guys, thank you for tuning in. If you have any questions, just drop them below and I'll try my best to respond and answer your questions to my full knowledge. So, all right, guys, I hope you have a blessed day. We'll talk to you soon. Bye, guys.